the general treatment of post-traumatic stress disorder depends on whether it is a purely clear post-traumatic stress disorder only with the symptoms that I mentioned initially under stress and post-traumatic stress disorder, or whether it's complicated by significant dissociative symptoms that requires special aspects of the treatment, or if there are secondary complications of the personality. If there are secondary complications by the personality, if really the trauma has acted as an etiological feature co-determining or determining a severe personality disorder, including identity diffusion, then the indication is for TFP, for transference-focused psychotherapy. If it is a simple post-traumatic stress disorder, the treatment really consists in the establishment of a safe condition of treatment in which the patient is invited to relive the traumatic experience in such a safe environment with the empathy and the understanding of the therapist who accompanies him in living this experience through. Patients may at first be very reluctant to go back to what is traumatic, with a phobic attitude toward the traumatic situation that may have to be worked through before one can really talk about what happened. But it is very important, after analyzing what prevents the patient to go back to talk about the terrible experience or experiences, once the patient starts talking about them, then to be empathically present, expressing appropriately the feeling of understanding how the patient has been feeling, but maintaining at the same time the attitude that's that characterizes normal attachment behavior of mother, which means congruence and marking. One expresses feelings that are empathic with the patient's experience, but at the same time keeps one's own experience sufficiently separate so that it doesn't become a reinforced, shared, anxious or disgusting or enraged experience, which tends to increase the traumatic effects of it. Very often one hears fearfulness expressed that one re-traumatizes the patient in going back to a traumatic experience. That is not so. Patients are not re-traumatized if one accompanies them with the feeling of empathy, but without a fusion, sharing with the patient the same experience